Good morning, good afternoon, and good evening to all of my wonderful colleagues. It's an honor and a privilege to be invited to join you today. Of course, it's wonderful, and I thank you so much, Professor Lee, and to the board for hosting this sixth meeting of the World Society of Disaster Nursing, and it's great to see friendly faces. It reminds me of the wonderful meeting we had in Bremen, Germany. So I thank you so much for that. Tonight, here in the United States, I speak to you to give you an update on the COVID-19 pandemic here in the United States and its impact on our frontline U.S. nurses. The situation here in many areas of the United States is quite grim. We are in our third wave of the COVID-19 pandemic, and it continues to escalate and spread unchecked. And so I will share with you the challenges that we have faced. We are a large country of 350 million people across 50 different states and many territories, and that has created significant challenges to any type of meaningful and timely emergency preparedness and response. Our nurses, of which there are approximately 4.1 million registered nurses working in the United States, have really borne the majority of the burden in responding to this pandemic, both at the acute care hospital level, to the community health center, to our home care nurses, and of course, our public health nurses. And I want to start off by providing some testimony to the inspiring role that our nurses have played in continuing to go to work each day through 3 different waves of surge of patients and with illness in their own homes and challenging economic and political times here in the United States. I work in the Center for Health Security in the Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland. And this is a photo of the COVID-19 dashboard that our university has created in an attempt to try to track the epidemiological statistics very specific to the disease. And as of last night, I can share with you that the numbers of our COVID-19 pandemic are truly grim. So we have over 15 million cases, 200,009 newly diagnosed cases as of yesterday, and we currently have 106,688 patients who are currently in hospitals in the United States with COVID-19. Over 20,000 of those patients are in intensive care units, and over 7,000 of those patients require ventilator support. Yesterday in the United States, we experienced 3,054 deaths due to COVID-19 in one day alone. Really very grim statistics that have so many of us alarmed and our healthcare systems on the verge of crisis. Earlier in the pandemic, I conducted a research study nationwide of the impact of the COVID-19 pandemic on our nation's nurses. And we saw then, because of the surge in the greater New York, New Jersey area, that there were significant challenges that nurses faced every day. There was a lack of access and chronic shortage of personal protective equipment. At that time, we were unsure that we would have enough ventilators. We were unclear as to the airborne transmission, and all of the modes of transmission of the virus were still, being revealed to us. And so there was an uneven application in the United States of those public health interventions, widespread masking, social distancing, avoidance of crowds, respiratory and hand hygiene, we had started to implement those non-pharmaceutical interventions to control the disease, but it wasn't adopted nationwide. It was adopted by a state-by-state method, and that created additional challenges. As I mentioned earlier, that June report revealed so many challenges and glaring gaps in national hospital and public health emergency preparedness for an emerging infectious disease such as the SARS-CoV-2 virus. We continue to have intermittent and persistent shortages of personal protective equipment across the United States. We now have plenty of ventilators, but our challenge is in having enough critical care nurses and respiratory therapists to staff those intensive care unit beds across the U.S. This has pushed many of our state hospitals into a situation where we have had to move beyond our conventional and even our contingency models of care and staffing, but to start to look at crisis standards of care due to the rapid acceleration of the COVID-19 pandemic. And so even earlier today, I participated in a national webinar on behalf of our Association of Colleges of Nursing in the United States as a call to action to see how we could involve our schools of nursing, our faculty, our students, and our staff to help support the need to enhance staffing for crisis standards of care across many of our states. I can't overestimate the psychological and moral distress that many of our nurses are experiencing, and our frontline physicians as well. This has been a huge emotional drain on our healthcare workforce at the same time that we have struggled with some economic challenges due to widespread closures of schools and businesses and other types of gatherings. And then, of course, with the social and political unrest that has challenged the United States throughout 2020. Sadly enough, many of our nurses and our frontline physicians have fallen victim to COVID-19 as well, or have lost family members to the disease. And it is becoming more and more frequent that people know someone near and dear to them who they have lost to COVID-19 in the United States. Throughout this pandemic, as I have taught and presented and trying to write guidance for nurses and hospitals across the United States, I go back to the many lessons that we should have learned from earlier infectious disease outbreaks, certainly the Ebola outbreak several years ago, and dating all the way back to the 1918-1919 Spanish flu pandemic, that should have really told us that we needed much stronger education and training regarding timely and appropriate public health emergency response, infection control and disease containment strategies, and the role of nurses in a flexible, nimble workforce that's able to be mobilized and deployed across state lines in the United States so that we can respond to the surge as it was created in various hotspots across the United States. Our numbers continue to increase, and yet our testing and contact tracing is struggling to keep up with this. While there is a vaccine on the horizon, we are well aware that the next 4 weeks here in the United States may be particularly difficult due to our Thanksgiving holiday, where so many Americans traveled and got together in large groups and ignored some of the guidance from our Centers for Disease Control and Prevention. As we move forward We are now rapidly implementing some critical staffing issues, looking at increasing our nurse to patient ratios. We are establishing satellite healthcare centers and mini hospitals off-site. We are looking at calling in nurses from education and administration in order to enhance our workforce numbers as we struggle to look at different models for interprofessional team frontline response to this disaster. We're trying to do a better job of load balancing patients across different hospitals and healthcare systems in the United States, although that in itself is challenging, as so many of these patients are critically ill and are very difficult to transport.